I'm going to set up a fecal float for testing for intestinal parasites. This is probably one of the most commonly used ways to test for parasites in the veterinary practice. It tests for most major parasites you would see in stool. However, there are parasites that can be missed because they do not float, like the fluke. So you want about 2 to 5 grams of stool placed in your cup. Oops. And then you fill the cup with the Fecasol. Mix it in there real good. And then you fill the cup up all the way to the top. And you want a convex dome over the top of it, like that, so that you can then take your cover slip and place it on top so that your eggs from your parasites will float to the top and stick to the cover slip. And now this needs to sit for approximately 10 to 15 minutes. And then you can look at take the microscope and put it on a slide and look at it under the microscope. And you'll be able to see the microscopic eggs from the parasites that this patient may have. This is a direct smear fecal test. So you need a slide, a small amount of feces. You don't want very much because then it will make the slide too thick to read. 1 drop of saline. And then you mix the feces into the saline. And then apply your cover slip and look at this under the microscope. This isn't the most common way to look for parasites. However, it's really good for finding Giardia in patients. It's also not considered a complete fecal test. You need to do more testing than just a direct smear. I'm now going to do a centrifugal fecal flotation. So this method is actually better than your float method. It allows more eggs to come up to the surface, especially those fluke eggs that will sink in a regular fecal float. So I need approximately 2 to 5 grams of my fecal sample in my fecal flotation solution, and I'm going to mix that up really well. And then once that is mixed, I now pour it through a gauze into my tube. And then once the tube is full, now I have a fixed head centrifuge, so I'm only going to fill my tube up to about 1 centimeter or 2 from the top. I've got my balance in here, and we're going to put the cover on it instead of using a cover slip, and centrifuge this at 5 minutes at 1500 RPM, and then we'll take it out. So now that our fecal sample is done spinning in the centrifuge, we're going to go ahead and remove it. Now, because I have a fixed head centrifuge, we're going to remove the cover, place our test tube in our test tube rack. We're going to fill the tube up the rest of the way and try to be gentle about it as not to disturb the eggs that have floated up. And again, we want that convex top to our tube. And then I'm going to place the cover slip on here and allow this to sit for 10 minutes before we then place it on a microscope slide and then look at it under the microscope for evaluation. Okay, so now I'm going to do a fecal sedimentation. So I've got about 30 mils of water here. I need about 2 to 5 grams of my sample. And you want to make sure you mix that thoroughly so that there's no chunks. The thicker pieces of stool will not drain well through the gauze, and you don't want to miss any eggs that may be trapped inside those larger pieces. So you really want to mix your sample quite well. And that seems to be pretty good. And then you want to fill your tube up about halfway, straining it through the gauze. And that's pretty good. And then what we're going to do is put the cap back on it. And we're going to place it in our centrifuge with a balance and centrifuge that on low for about 3 to 5 minutes. Okay, so our sample is done spinning in the centrifuge. I'm going to remove it, and you can see there's a nice sediment now in the bottom of the tube. I'm going to pour off the supernate, trying to not disturb the sediment. And then I take my pipette and get a little bit of that sediment, place it on a microscope slide with a cover slip. And then we would review this slide under the microscope for evaluation. Okay. So I'm going to demonstrate a free catch sample for urine collection. Ideally, you want a free catch sample first thing in the morning. That way the dog hasn't drank usually they haven't drank all night, they've been sleeping, their bladder's nice and full. So you can get a good idea of their urine concentration to see what their kidney function, that helps you see what their kidney function is like. And then you want a midstream catch. The reason you want the midstream catch is because the first urine that comes out may have contaminants in it. And then also you want to use a clean, dry container to catch the urine. You can use, we like this ladle. You can also use vaccine trays after the vaccines have been emptied out of it. Those are nice to use. We're going to use this ladle. So we're gonna catch urine on this dog here. So it's tricky. We're gonna walk him, and you gotta, it's tricky. Especially when you're by yourself. Come on up closer so we can, come on, go pee-pee. Go pee-pee. Good boy, go pee-pee. Come on, go pee-pee. Good boy, go pee. Good boy, go pee. Good boy. Good boy, go pee. Come on. Good boy, go pee. Come on. Good boy. Come on, go pee. Come on. Good boy, go pee. Come on, good boy. Good boy, go pee. Come on. I can edit some of this, you know what I mean? Good boy, go pee. Come on, Lily. Go pee. Good boy. Come on. Come on, go pee. Good boy. And now what you want to do is, is get some of the urine into your syringe. Just like that. So this was his free catch urine sample. It's clear. The color I would say would be light yellow. It's definitely clear because I can read the numbers through the syringe on it. There doesn't seem to be anything floating in it. So the clarity and color is really good. So there are 3 ways to do a cystocentesis on a patient. The first way would be palpation, where you would lay the patient in lateral recumbency and actually palpate the abdomen to feel the bladder. If you cannot feel the bladder, you can do something that's called a blind stick, where you lay the patient in dorsal recumbency, and between the umbilicus and the inguinal area, you would apply your alcohol, and where that alcohol or cleansing solution pools is considered where you would do your blind stick. The third way is through an ultrasound guided cystocentesis, which I'm going to show to you on video. I'm going to demonstrate a ultrasound guided cystocentesis. So we've got the patient here in lateral recumbency. I'm going to spray a little bit of alcohol to get some contact for my ultrasound probe. She okay? Mm-hmm. Yeah. And I've got a 3 cc syringe with a 1.5 inch 22 gauge needle. So the first thing I want to do is locate the bladder. There it is. Try to get into focus here. There we go. So now that we've got it in focus, I'm going to go to the cranial aspect of my probe and gently poke into the bladder. You can see my needle coming in. Pull back to get my urine sample. Can you come around here so you can see me drawing back? You can see I'm getting the urine into the syringe, and then I'm going to release the pressure, draw my needle out, carefully replace the probe, and I'm going to recap my needle I want to clear the hub of the first little bit of urine so that there's no contamination. Undo my tube and then place the urine into the sterile tube, because that was a sterile collection, and then recap the tube. Now this urine is a dark yellow. It does appear to be clear. There is a little bit of contaminants floating in it, so it'd be interesting to spin that down and see what's going on inside this urinalysis collection. So the three main types of urinary catheters that we use in the veterinary hospital would be the Foley catheter, the polypropylene catheter, and a red rubber. The Foley catheter is too small for large male dogs. It won't reach the bladder, so it's good for female dogs for collection of urine. The polypropylenes are longer than the Foleys and the red rubbers, so those are excellent for large male dogs. They can also be gas sterilized easily and used in surgery for cystotomies and things like that. The red rubber catheters, I feel like, are the most commonly used. We use those quite a bit for maintaining blocked kitties, as well as a variety of different male dog catheterizations for collecting urine, or smaller dogs that may need a catheter in for a few days. Okay, we're going to demonstrate a urinary catheterization with sterile technique of a male dog. So you ideally want them laying down, but first I'm going to show placement of the catheter, the positioning. So ideally you want the end to be coming out of the penis, and as this wraps around, you want the tip of it to be almost to the flank. So that's about how far in we need to place this catheter for this dog. So we're going to lay him down in lateral recumbency. And I'm just going to clip a little bit of this hair off, just to keep it as clean as possible. Then I'm going to put my gloves on. Are you gonna put my sterile gloves on? So we're going to clean the tip of the prepuce with just some chlorhexidine. It's cold, buddy, it's cold. And then wipe that off with a little bit of saline. I know it's cold, I'm sorry. I'm sorry. So I've got my sterile urinary catheter here. And I've cut the tip of the plastic so that I can slide this without touching the urinary catheter, and it'll go sterilely into the penis. So we need to lubricate the tip of this. I'm going to put some sterile lube down so that I can put the lube on sterilely. We're going to insert the tip of this catheter into the penis and gently feed sterilely, so I'm not touching the urinary catheter. We're almost where we need to be. Also want to be careful not to touch the end of the penis with the paper, as you don't want to accidentally damage the tissue at the top of the penis. Last few placements here. Easy, buddy. Easy, you're okay. Almost there, dude. You're doing so good. We're almost there. Oh. Alright. We should be good. So I'm going to take this off. And then using my syringe, I'm going to place this on the end of the urinary catheter and draw back gently. And we're getting urine, but what I'm going to do is I need to get rid of this first few milliliters of urine because it would have the most contaminants in it. So then I'm going to replace my syringe and draw back to get me a fresh, clean, sterile sample. All right, and then now to remove the urinary catheter, you want to pinch it off and just pull back slowly and gently as not to damage the tip of the penis or any of the cells on the way out. Good boy. That's it. So this is my urinary catheter sample. This sample, I would call it cloudy. It is definitely harder for me to read the numbers through the syringe. I would call it a dark yellow. And like I said, the color would be, clarity would be cloudy. So we're going to do a vaginal cytology on this 13-year-old Chihuahua. She can be a little bit nippy, so we went ahead and sedated her for this. And we have tied her tail up so that I may assist Dr. Harrington more efficiently with the cytology. The reasons you would want to do a vaginal cytology would be to find out what part of the estrus cycle the female dog would be in. That way, and it helps with breeding to know when the female dog is actually in what part of the estrus cycle she's in. The other thing I feel like it would be helpful with would be if you have a female dog that just has recurrent UTIs, lots of issues going on in the urinary system. It might be helpful to collect some cells from inside the vaginal cavity just to look for neoplastic cells as well as any other type of infectious cells that might be there. So the first thing we're going to do is clean the vulva very well. We're going to use chlorhexidine. And then I'm going to use sterile saline to rinse it. And you want to make sure that that site stays clean. You wouldn't want your tail to flap back into it. And now, I'll do a little bit of lube. So I'll go ahead
and I'll make sure I keep that tip clean. Okay. She's asleep.
Mm-hmm.
Okay.
All right. Now I'm going to hand you the sterile swab. But before I do, I'm going to rinse the swab with sterile saline to moisten it. It allows for better and easier collection of the sample without damaging the vaginal wall.
Okay. My keeping sterile technique. I will insert swab cranial urethral opening. Like cells, a little twist. And draw out.
And now I'm going to roll the swab onto a microscope slide and allow that to dry and then stain it so we may look at it under the microscope.